recording in progress. Well done, the efficient team that they are. As I say, if anyone wants to introduce themselves in the chat, the running order today is lovely. It's very well organised by our lovely team. It's me waffling on a little bit for a few minutes about the housekeeping and telling you what's what, recording and the agenda. Tim is going to do a little bit of an introduction for just about 5 minutes about what the services and the aims are. Shahida, the wonderful Shahida, is going to do a 10-minute talk from Faithstar about context about BAME and loneliness. You'll be aware that loneliness and isolation, there's been many events and many webinars and many workshops and all sorts of things to do with loneliness and isolation, particularly through, you know, organisations like the wonderful Age Better and what have you that we've all been part of over the years. But nobody, as far as I'm aware, has done this specifically for the BAME community, which is quite a niche thing, but a wonderful thing, clearly very much needed. So well done you for putting this together. So Shahid is going to talk about the context of that, really. Rehneesa is then going to tell us about the project, what's brought it together, why she's putting her time and energy into this and why it's so important. Then we've got a bit of work for you guys. We're going to go into a breakout room, love it or hate it, just to have a bit of discussion, a bit of feedback from you of what, two sort of questions really. What's your experience been about working with BAME, lonely and isolated older people, and what you may or may not have put in place already. So a nice small breakout room where you can talk to each other and learn from each other, really. Different experiences, different trials and error things that you've done. I know there's people here that work specifically with that sort of age group, and there's people that have done lots of work in this before, and there's people that haven't at all, really. So it'd be lovely to have that interaction between you all to see what we can learn from each other. Then we've got the wonderful Sarah NG from the Chinese community joining us, hopefully, and she's going to talk quite specifically about hate crime in the Chinese community and the impact it's had on the older community and how that's led to loneliness and isolation. I've heard Sarah talk about this before, and it is fascinating and very relevant, obviously, for us in Sheffield. Then we've got the wonderful Naureen from St Luke's Hospice coming to talk about, again, something very specific about bereavement and palliative care, which I think will be absolutely fascinating. Naureen's a fantastic woman and very knowledgeable, so that'd be really great. We're then going to go on to breakout number 2, and there'll be a couple more questions about what we've learned today, which will be really good, and we can have feedback from that. And finishing off with question and answers at the end. So if you've got any burning questions, guys, write them down, and there will be a section at the end where you can put your questions to any of the panelists, yourself or anybody, bless you, whoever that was, towards the end. Which reminds me, housekeeping, the lovely Erica is going to take away the chat function while people are speaking, while we have the guest speakers, just so we can concentrate on the guest speakers. That function will be taken away, but it will come back. So you don't worry, you will be able to chat to each other and message people if you want to do some networking. That will be there. There's no toilet breaks or anything like that on the agenda, but obviously we're all adults. If you need to hop off, you hop off and go and get your caffeine fix or whatever you need to do, but come back clearly. And I'll be shoveling muesli down, I'm sure, at some point, but hopefully you won't have to see that. So right, is everybody feeling okay? Is that sounding about right? Yeah, right, looking forward to it. So can I introduce Tim, please, who's going to tell us a little bit about the services and aims of SM4Cs. Over to you, Tim.
Okay, thank you very much, and welcome everybody to this event, which I'm sure is going to be a really useful and powerful way to spend the morning. As you might expect from a chair of a voluntary organisation, I've been given a very clear and strict briefing from my support team, and in the main I'm going to stick to that, but I'm going to change the order slightly of what I say. We tend to refer to ourselves as SM4Cs these days. Our origins are actually from within the Christian community in Sheffield, and our formal title is still Sheffield Church Council for Community Care. That's actually a real misnomer now. We were set up as a separate charity about 5 years ago and have no organizational links to any religious bodies, and we don't actually have any religious orientation any longer, but we do want to recognize the very significant contribution that was made in setting the organization up in the first place. As an organization, we've become increasingly clear that we need to improve our performance in serving the diverse community in Sheffield. We do have a reasonable number of people from diverse ethnic backgrounds amongst our clientele. We don't have very many people working for us. We have nobody on our board at all from any sort of diverse background. And what Mark had asked me to finish the conversation with, but I'm going to start it now, is that we are really trying to address that issue of getting diverse representation on our board. And if there's anybody in this audience who is interested or knows of people who might be interested in talking to us about becoming trustees or board members, be very pleased to hear from you. Either contact me or one of the team through the chat or thereafter. And that will be a really good way of helping us take things forward. We provide care and support for older adults in the community in Sheffield through three main streams. Our classic service is the Good Neighbours scheme, whereby we match volunteers. We have about 200 volunteers that are working with in supporting people who are isolated and alone. That, you can imagine, has been a particular challenge during the epidemic, and the team will tell you as we go along about all the innovative things we've done to overcome that through IT, through a brilliant pen pal system and the like, and that is supporting a very large number of people. Over the years, we've also developed a really effective relationship with both the NHS and the local authorities in the city. And we provide, in conjunction with them, two very powerful programs of hospital aftercare, in which we can provide sort of social contact, but also a lot of very real material support in terms of delivering aids, emergency shopping, key safes to keep houses secure and allow professional staff to enter to provide services. And we also have a hospital to home system, which is primarily about transporting people being discharged from hospital back to their own homes and cutting through a lot of the problems we have on transport and pressures on ambulance care and the like. So overall, we've got about 200 volunteers who are providing help to, at the moment, about 3,500 people a year, and we expect that to reach something in the region of 4,000 by the end of this year. And so again, if people are interested in volunteering with us or have people they would like to point in our direction to work with us as volunteers, we'd be really pleased to hear from you. As I said at the beginning, we are very concerned that we need to up our game in terms of reflecting and meeting the needs of the whole diverse community in Sheffield, and are continuing to do that, to work on that. And this event is really part of our programme of engaging more fully and more effectively with the whole community. And I hope you'll find today a useful and effective way forward. Thank you.
Thank you very much, Tim. That was a lovely explanation of what you do and what your values are. Thank you. I know you just mentioned about diversifying the board. I know the organisation I work for, Voluntary Action Sheffield, did a huge event about that subject. And we are trying to do some more follow-up stuff. It's not just a matter of finding somebody, but how to come along the board about how they would feel and how they can be made welcome and how they could overcome barriers of language and whatever else, really. So it's a huge subject matter, that, and there's a lot of interest in that in Sheffield. But yeah, hopefully on the right track to getting there. Right, have we got the lovely Shahida? We're going to move on. Shahida's got 10 minutes, bless her, to talk to us about something that I know she'll get incredibly passionate about. Shahida is going to talk about context to do with BAME, loneliness and isolation in the older community. Thank you, Shahida. Morning.
Good morning, everybody. Can you hear me okay?
Yeah.
Fantastic. Thank you. So good morning. It's a real pleasure to be here this morning. The loneliness and BAME older people is a topic that's really close to my heart. So I'm really pleased to be here and to just talk a little bit about setting the context and setting the scene for Sheffield. Before I sort of get into the detail of some of that, I really want to kind of just go from a demographics point of view and just set the scene there a little bit, because that will then later on explain some of the stuff that I'm going to be talking to you about. So in the just after the Second World War, we had the Windrush generation. We had many people from around the world coming to Sheffield for the steel industry and the coal mining industries and so on and so forth. That was predominantly a male population to start with, and then later on towards the 50s and 60s and 70s, those men started to bring their families over, and so communities were starting to develop around those demographics. So there was that change. There wasn't so much around older people at that time because it was a very young population that was coming to Sheffield. They were all working age populations. So fast forward a little bit, in the early 80s, the BAME population for Sheffield was at around about sort of 9.6% of the total population of Sheffield. Fast forward a little bit further to the early 2000s, and that went to 12.4% of the population. In the early 2000s, 2014, 2015, you were talking about 19% of the population. But by the year 2025, 25% of the population of Sheffield will be from a different cultural background. So that gives you some indication that not only is this a growing community in terms of new arrivals, but in terms of long-term established communities have been here for a very, very long time. Our oldest community in Sheffield is the Yemeni community, and they had families and communities here from the mid 18th century. So we do have very long-term established communities here as well, but actually that is being in line with kind of industrial changes and growth in the city. The implications of all of that have been that those very early generation, those very early first migrant working families that came to Sheffield, time moves on, families get older. And as you've moved into sort of the third, fourth, fifth, sixth generation of younger people, their grandchildren, great-grandchildren, you can see that the pressures on families and the dynamics in families from different cultural backgrounds have changed. And over the years, that change has been quite significant. So there is a perception, and there's a cultural perception, that from communities within Black, Asian, minority ethnic communities, they look after their own. So that's the perception, that's the view. And there's this idea that actually, from a health and social care perspective, well, we don't really need to pay that much attention to the older people within BAME communities because they look after their own. And actually that might have been true for a generation, but actually subsequent generations, that's not true. And there are many reasons for that. One is working dynamics. So you have currently got people of my generation and younger who are in education, who are in work, so they've got work dynamics. They've also got younger children, so they've got childcare responsibilities, and at the same time they're getting pulled in two different directions. So you've got very young families with very young children, but families also with aging parents or aging grandparents and aunties and uncles and so on and so forth. So the stretch is happening in two ways, particularly for BAME communities in Sheffield, because overall BAME communities in Sheffield are quite a young population. That isn't to say that the older population isn't growing. It is significantly, but the pressures on families are very, very different. So what you also have is the dynamics of at a time when culturally and traditionally many BAME communities followed a kind of very traditional kind of you know, the men would go out to work, the women would stay at home, and if there was any older parents, the women would do all the looking after children and older parents. And that isn't the case anymore. The case is very much reflective of wider society, where actually you need both sets of parents, you know, to be out working, and the pressures on families are very, very different. Services for older people haven't really understood that over the last few decades, and there has been a significant disconnect between services for older people, particularly BAME older people, and not just meeting their cultural needs. I think people have come at it from, oh, well, if we translate languages and get services out there and we translate them into XYZ language, that's it, job done. It isn't. Actually, there are a whole host of cultural support needs. There are a whole host of cultural and religious needs that need to be met for BAME older people. And it's also about having appropriate settings within which they will feel comfortable. So yes, you've got your lunch clubs, yes, you've got appropriate care services, but it's actually taking that one step further. And that's making sure that when we design services for older people, that we're not just designing them with our own perception of what we think those communities are, but going directly to those communities and saying, well, what is it that you need? What is it that your families need? And that can be very different. So for a lot of people within the BAME communities, loneliness is a key factor, particularly around the working hours. So normally if they're part of a big family or they're part of a traditional family, yes, there's people coming and going all the time, but actually that is less and less now. They're seeing less and less of their family because they're either at school, they're at work, and it's kind of, you know, during working hours, those times are getting more and more reduced. Similarly, access to service isn't that simple anymore. So whereas before, yes, you know, you've got the mosque, and many people from within the Muslim community, for example, that older men would go to the mosque, but actually if you can't travel from home anymore and transport is an issue, then actually many people are now finding themselves stuck at home. Similarly, the kind of social clubs and clubs that they would frequent when they were much younger are getting harder to access. So things like, some of the ways that we need to think about loneliness is also about community spaces. It's about shared spaces, and it's about shared cultural spaces, which those communities connected with each other, and their wider communities as well. So how am I doing for time, Pam?
Not bad. Actually, give you another 2 minutes if you like, Shahida. Okay. Go on.
So really what I'd like to kind of focus our minds on in terms of loneliness for BAME elders is very much the context of their lived experience has changed vastly from what we thought it was. And I think policy and design around older people's services, we need to design that in mind for where they are right now, not for where we perceive them to be, you know, 30, 40, 50 years ago. And similarly, I think those cultural perceptions of where we think, oh, well, it's okay, the community will step up for them. Yes, the community will. Those traditions haven't gone away, but the pressures on family to meet the demands of those traditions, to meet the demands of supporting their elders are absolutely huge right now. And so what we need to be thinking about is in a wider family and community context to support those BAME elders.
Thank you so much, Shahida. Absolutely, as I would expect, beautifully put, and you put that in a really, that was the whole point, putting it in context. I think it's fairly obvious from what you're saying that, as often is the case when we talk about BAME stuff, is the answer is complicated. It's not one size fits all, and that takes effort and work and education and all of those things. So thank you, Shahida. Bless you. Right, over to our lovely Rehneesa to talk about the actual project that SM4Cs have been getting involved in.
Yes, hello everybody, and thank you so much for joining us today. So I'll talk a bit more about, like Pam mentioned, what the project actually is and what I have found through the project, what challenges we face, and also some recommendations for you if you're experiencing the same sort of challenges or want to implement something within your workplace. So in a nutshell, what I do as part of my role is making our befriending scheme more culturally inclusive, putting that specific emphasis on directly engaging with our BAME older people and also our volunteers. Before we begin though, I just want to clarify that within the ethnic minority community, although we face similar experiences and challenges, there are still a lot of nuances, and it's really important that they all get heard and are not brushed under one rug. You might have noticed, for example, on this occasion for the event, we don't have any African Caribbean representation or any male representation. For this occasion, it wasn't able to happen, but I just like to say that the voices that you hear from today, they do not represent the experience of all the older people. It's just like a small snapshot from what we have experienced. And also with why we're even hosting this event. So through my networking and discussions with other community workers, I realized that some of the challenges that the older people face in our community isn't as widely known. And Shahida has nicely put it all together, giving you a bit of a snapshot about that too. Sometimes people know the issues, but for various reasons they don't know where to start. Also, there are already challenges, barriers already working with older people in general, regardless of their background. However, on top of this, if you add existing inequalities, language and cultural barriers, impact of COVID, it makes the situation a lot more complex and challenging and confusing. So in a way, I want to have this platform where we can talk about the deep underlying issues with our community leaders that affect our ethnic minority older people, and also have something that's specific to Sheffield, so that's relevant to the people who are living and working here. And it's not just about gaining the knowledge, it's also about what you can do yourself whilst you're interacting and working with these older people to better support them. That can range from reframing the way you look at older people's experiences, to making like structural changes within your organization, whichever works within your capacity. So in terms of the project, as I mentioned, I've been working towards making it more culturally inclusive and having that specific emphasis. I started off with individually contacting various ethnic minority community leaders and had chats with them to directly hear what issues they are facing, what's the situation like specifically in Sheffield, what guidance they have for me. And I very quickly realized that there's a lot more beneath the surface. I think it's always very important to hear direct from the people, rather than just going on what you think might be the case. Also, we did specific call outs to volunteers who are from various ethnic minority backgrounds, who can speak different languages, so that we can support older people and are in a better position to support them if they have like language and cultural needs. I feel like overall as well, we've, as an organization, we've gained like a broader understanding of how loneliness affects the ethnic minority older people. And I feel through this and a lot more other things, we've managed to like steadily increase the amount of volunteers that we have and the amount of older people we're able to support from the ethnic minority community, as well as being able to build those links and bridges with the ethnic minority community leaders. And moving on to what works well, or some of the challenges that I faced, and what you can do, I found that there's literally no quick fix at all. There's years and years of mistrust, discrimination, racism, stereotypes, cultural and language barriers that need to be undone. So there isn't like a one size fits all solution either. I've also found that it's really important to be open-minded, to listen to different perspectives on the same issue. On like an even practical level, even making small changes like having a section about the older person's cultural, religious or language needs on your assessment forms or on your records, or asking volunteers or your staff members what languages can they speak and would they be willing to support an older person whose like language and cultural needs that they meet. It's something that we didn't have officially on our records, but it's something we have implemented. And it's a really small change, but I feel like it makes a big difference, because it means that we are now prepared from the outset to ensure that we are better able to support our older people. So if it's not something that you've done already, I really suggest that you do it, because it's a simple task, but it's very easy to miss. And another thing, I've also found that it's really important not to assume that it's not just about having volunteers from different backgrounds, not just about having staff from different cultural backgrounds, and don't assume that the older person will want somebody from the same community as them. Sometimes they don't want someone from the same community because of fear of judgment. Other times they really just don't mind at all. They're just happy to be receiving support from any friendly person. The key thing is not to assume, but to still ask their preference. We have white British volunteers supporting our Jamaican service users. We have Chinese volunteers supporting our white British service users, and that's been working well. And it provides like an opportunity to build like the cross-cultural connections. In terms of a few challenges, I found that it's a bit easier to recruit the younger volunteers from different cultural backgrounds, mostly British or university students. I feel like with them, there's a lot less cultural barriers and they are more open and used to the idea of volunteering. And I found it more challenging to recruit the older volunteers. There's various reasons for it, but I think one of them might also be they're not as used to the notion of volunteering, especially if it's not the done thing back home. And that's something we're still working on. Obviously, COVID has made a massive impact. We had to change our befriending visiting to telephone support only. And when I joined, it was at the start of the lockdown. So I had to set up infrastructure whilst working from home. And I feel like when there's language and cultural barriers and difficulties, there's mistrust as well. It's harder to build that rapport and trust over the phone. But hopefully now that things are a little bit more settled, it means I can get out there a bit more. And in terms of like moving forward, we are always looking for volunteers, particularly those who speak additional languages. At the moment, we are in need of people who can speak Arabic and especially Yemeni. We're also in need of people who can speak Urdu and Punjabi, especially if you're a female speaking Urdu and Punjabi speaker. So if you would like to volunteer and can speak those languages, please do contact me. We do have a few people who could do with some support. We also have several volunteers who are from various cultural backgrounds and who can speak different languages fluently. They are available to support an older person whose language and cultural needs they can meet. I will put like a list in the chat of some of the languages that we can cover. So if you have any service users who could do with that language or cultural support, then you're welcome to refer them to us. And also just as like a final thing, depending on how useful everybody finds this event, it is potentially something that we can carry on doing. As I mentioned, we haven't been able to include all the voices today. So maybe for future events, we can hear more from the voices that we weren't able to include today. And yeah, I hope you all gain what you want from this event, and looking forward to see how it all goes as well.
Brilliant. Thank you, Rehneesa. Thank you. That's really interesting to get a bit of the background, and it's really inspiring to hear what you've already achieved in your whatever short time you've been with SM4Cs. Really, there's a lot of learning there. I think we could all take something away from that. So well done, you. Keep up the good work. Keep up the good work. Just a reminder that there's now 59 people in this chat, which is absolutely incredible. You know, well done SM4C's team, and also a good indication of how important this subject matter is. There's quite a few people that joined a little bit later. So for those that joined a bit later, if you want to change your name, if you know how to rename yourself, it's the little 3 dots in that corner, and put your name and the organisation you represent, or if the chat function, when that's open, if you want to introduce yourselves properly in the chat function, that'd be really good, because a lot of this, as I said earlier, is about networking, and there'll be people here that you perhaps haven't come across, and it'd be absolutely fantastic if we'd be all working together. Brilliant. So the breakout rooms are coming up next, guys. I think it's about 10 minutes. Somebody's going to work their magic. It's not me. I don't do technology. Somebody's going to work their magic, put us all into small breakout rooms, There's pretty much 2 questions in that. We're going to have another breakout room later, so they're just 2 short breakout rooms talking about our experiences of working with BAME isolated older people, if we have any. We may not, so we could then learn from other people and what we've put in place, what's worked, what's not worked, really. So somebody's kindly put the questions in the chat for us so we know what we're doing. So does somebody want to work the magic for the breakout room, guys? 10 minutes, and then we'll see you back here, and then we can have a bit of feedback session, see what we've learnt, and have a little bit of an open discussion after. If anybody wants to feedback, I don't suppose there was necessarily anybody nominated to talk back, but the questions were about your experiences or lack of experiences already in loneliness in the BAME community, in the older BAME community, and what people have put in place already, what's worked. Yeah, I want to hear everything, to be honest, but is anybody brave enough to kick off and say what was talked about in their group? Any particular themes? Anybody brave enough?
I'll go fast.
Go on.
Yeah, Sina from African Voices. Yeah, we kind of like talked about some of the challenges. And basically loneliness, isolation within the BAME community, especially among the elders. I think there's been quite a big shift, to some of their experiences, and some of them are new to this country. And being a community, I mean, when you look where they come from, some of these African elders don't know anything to do with isolation or loneliness. They're used to having around big families, with them. So it was kind of like a shock, to them, and they're kind of like they developed quite a few issues, but also trying to address that was also a challenge, because quite a lot of them come from different backgrounds, different languages, different cultures. So among the strategies we use, we kind of like try to rebuild that sort of like African environment around them, to know that they're not far away from home. There is people that can come around, have a chat with them, have a cup of tea, just basically try to keep them busy, if you like, but also having the element of being isolated from the rest, wasn't an easier thing. So it is still a new journey, but which I'm pretty confident that, we will try and cover those gaps as we go along, as we try to network with each other.
Fantastic, thank you. That was really, really insightful. It's almost like trying to recreate what they used to have around them, that little network, that support network that we all need. Brilliant, thank you for that insight. Anybody else? Your personal experiences, things that you've come across, themes that you've seen? Is there anybody frantically waving their hand?
Yes.
Go on.
You want to go, Shema?
No, you can start saying. You can start.
Cool.
Yeah.
Cool. Yeah. So one of the nuances which I've come across, as being a caseworker, is that where you can work for the older people you're dealing with, or you can work with. And I feel like using co-production techniques is very important, because you're not dealing the issue on a surface level. You go into the root of it, and you're making them empowered. So say, for example, when I was dealing with some of the older clients, they needed help with downloading Gmail accounts. So instead of me downloading that for them, I guided it through them. I gave them the phone and I guided them. So now they don't need me. And even when they're by themselves, they can download any other Yahoo account or whatever. And what that's doing is it's helping them be empowered, and it's helping them become less dependent on us. And I thought it was an important nuance, which, we need to take into consideration when dealing with especially older BAME members.
Fantastic, Zane. Well said. If this was a job interview, you'd have got the job. Thank you. Shmark, have you got anything you want to add?
Yeah, and what I want to add is Somali mental health prefers have 2 groups, men's session and also women's session weekly before pandemic. But after pandemic, we started WhatsApp group, and then Zoom group. And mainly it works in Zoom group because people, they can see each other, and they do a aerobic, which Papa also we commission it. So they dance, they do, so that it was really affect positively and reduce the level of isolation. But they need a resource. What we do is we give a top up of the data and because some of them they have no resource money, so we give data, and some of them they don't know what's called a Zoom platform, so we train them via their WhatsApp, and we send the links, and then they connect us, and we did a weekly workshops with them, and then they come our weekly seminars and workshops, and they see people regularly, which mainly reduces their isolation. And the other thing is what we do is we do a welfare call in the morning, and we contact them, some of them in 9 a.m. how they're feeling, how they are. So, and not only calling, but also giving the resource they need, like the data and the minutes. So that is really worked it.
Fantastic.
Yeah.
That's absolutely lovely. Remind me, Shamarka, I should remember which organisation you represent.
Man, Somali Mental Health.
Of course it is. Yes.
Yeah.
Fantastic work. Absolutely brilliant. Lovely to hear. Thank you for sharing that with us.
Thank you.
Right. Anybody else want to share their experiences? There's lots of different experiences, isn't there? Lots of different things, different techniques people are doing, which is, the answer, isn't it? Not one size fits all. That's coming across quite clearly in this webinar already. Does anybody else want to share any discussion that you had in your breakout rooms? Any theme? I particularly like the suggestions of different things that people have achieved and things that have worked for people. That's always a good thing, and that's always a good thing to share with others. We can pinch each other's ideas or learn from others' mistakes. Any more?
I'm just pointing out something. It's one of fun experience I had with one of actually two of the BAME elder advice support is that they do not want to engage with members of their own community. There's that kind of distrust, especially this one who's from Yemen, and of course does not trust people in his community because they come from a different part of Yemen, but they much rather engage with people from other cultures, and having that, you can sometimes use that as a way to engage with the different parts of the community that they might not necessarily have. Like, for example, religion is important to them, so they don't mind going to a mosque with a friend, but at the same time, they like to go to a park which is not in their neighborhood, where they're not going to run into anybody. So like I've done a few walks, I've taken them not exactly across the city, but far enough to a place where they're not going to run into anybody that day, and I find it that way. So it's several nuances that we're talking about.
Really good point, Zaid. That's really good point. It's not, I think then somebody mentioned it earlier as well, isn't it? It's about not an automatic assumption that people from one culture want to mix with people from the same culture for all sorts of complicated reasons, really. I really like what Rehneesa was saying earlier about people from the Chinese community going and visiting people from the white British community, and we can all learn from each other, because Sheffield obviously is a wonderful multicultural city. But that's really good points. Thank you. Anybody else got anything else they want to add? Any more insights? Anybody? If not, we can move on. We can move on to our next speaker. Thank you very much. Thanks everybody for feeding back from those breakout rooms. So our next speaker, moving on beautifully, is the wonderful Sarah NG, who's the chair of the Chinese community trustee board, aren't you, on the Chinese community? I've heard Sarah speak many times, and it's really interesting. So Sarah, you're going to talk about, thank you for joining us this morning. You're going to talk specifically about hate crime in the Chinese community and the effect that's had on their older people, and I know you could probably talk for an hour on this subject, but if you can try and condense it to 10 minutes, that would be wonderful, Sarah.
I will aim at that. Can you hear me all right?
Yes, we can. Thank you, Sarah.
Right. I'll just give you a very brief background about the Sheffield Chinese community first. The Sheffield Chinese Community Centre was established in 1995, but the community spent 10 years fundraising, raised 30,000, matched funded by the Sheffield City Council, and we purchased our own building on London Road. And we've been operating since. So activities and services include supporting community in health and mental health services, acting as a bridge. We have welfare advice, work with the CAB, and they're based at the community centre twice a week at the heart of Sharrow, so enabling other communities to access a service on their doorstep. We work with older people. We have luncheon clubs twice a week, children and young people's project, working with schools as well in terms of community cohesion, English classes, computer classes, any other classes that link the community into the wider world in terms of integration, weekly health activities, health talks, and then monthly birthday celebrations. So for those that live alone, isolated, anyone who has a birthday on a month, we host a birthday party at the first of each month. Anyone, any community can come and join in to celebrate together. But I'm going to specifically talk about support for older people in terms of all the work that we do. So for older people at the community centre, we have weekly health talks, any topic, diabetes, heart problems, heart disease. A lot of the work we do is in terms of prevention. Fun English classes for older people, individual little words. We make it fun, so there's no pressure and it's not stressful. Weekly luncheon clubs, Tuesdays, Wednesdays. A lot of the people that live alone quite often don't have a proper meal. They might not even cook a proper meal. A proper meal might be just once a day or once every other day. So we have 2 luncheon clubs for that reason. It brings them out of the house. After the luncheon club, there's activities like aerobics, like one of the colleagues earlier mentioned it as well, which is fun and it's engaging. We have chitty-chatty afternoon tea and a topic of their choice for the next week. Someone might decide they want to talk about padded nappies, for example, and that's fine. And that's a topic of choice for once every week. Birthday celebrations I've talked about, colouring sessions, stress-free whilst they're colouring. Again, people talk about any topic and everything, and it's about bringing people out and being able to express themselves and feel as if they could, it brings them out of the isolation. Most of the community members that we work with, the older community members over 65s, half of those live alone, isolated, scattered throughout Sheffield, simply because of the way, like Shahida was talking about, a lot of this generation arrived in UK when they were young men and young ladies in the 50s, and they are now in their 70s and 80s, and some of them are even older. But because of the competition rules, out of respect back in the day, when they settled in Sheffield, they opened a business, a takeaway or a laundrette. It was always far away from each other to give each other that space, and that continued throughout their lives in the way that we are all scattered throughout Sheffield. The other work that we do with the older communities, the health and medical support, arranging transport, arranging prescriptions and medicines, and making sure that they're registered with GPs and opticians and dental surgeries. So the usual support we provide for the normal community, the older community, is a continuous support. Volunteering opportunities for older people, this has become part of their lives. In our breakout sessions, I think we were talking about older people and working with older people as well. Volunteering opportunities at the community centre for older people that I have seen become some of these individuals' lifeline. It brings them out of their house. One of these members that come every single day to community centre, she works as the receptionist, and that allowed her to step out of the house. And having said all that, along came COVID, and that's changed everything. So all the above activities that I've talked about is pre-COVID. But this, the next few slides just gives you a bit of an idea as to these are, I know, big groups, but this is pre-COVID, what we did on a regular basis. So there are talks, fire safety, we have fall prevention class, support from the local businesses. We have a time where they were interrogating a local councillor. We have English classes, volunteering, and then so this is a birthday party that you see here. So each one of those individuals have a birthday on that same month. So if we're I'm going to move on now very quickly, and then I'm going to go and talk about post-COVID, what happened during COVID, what changed. The impact of COVID had meant that we've had to work in so many different ways. The second home that Chinese Community Centre was to older people was then closed. We had to close because of restrictions. And that led us to realise very quickly that there was a digital divide. Whereas we assumed that the community speaks Chinese, can read Chinese, these individuals that arrived in UK in the 50s quite often only had very basic or next to no written Chinese language. So reading was a big issue. And because reading was a big issue, and so was having a computer or having any digital device. And we quickly realized that a big proportion of the elderly community didn't have, all they had was a home phone. So for a year and a half through COVID, they were isolated in terms of language and information. The only way they were accessing information was they translated paper information that we were posting to them, telephone calls that we were providing daily on for those that was on the care list. This information was a big part of a big reason of the community being confused, taking up vaccination, not taking up vaccination. A lot of the word of mouth information was being spread, and the community centre was having to work extra hard to combat disinformation coming from social media, then being spread by word of mouth. So that was one battle we had. But in terms of loneliness and isolation, it was two battles that the older Chinese community members had to face. The biggest one was hate crime. At the very beginning of the pandemic, a year and a half ago, a student got attacked for wearing a mask on West Street. And then subsequently, further attacks were experienced by different members of the community throughout Sheffield. Not all of them reported. The community centre have tried to work with the authorities and the police from a very early stage. The figures that the police had for hate crime was next to none, whereas the experiences on ground level was horrific from my point of view. Every person and every other person I speak to have experienced some hate incident or hate crime, or they know of someone that have. And because of that, you'd expect people the community talk to each other, they warn each other. And because of that, isolation and loneliness became complete, absolutely complete for older people. It meant as soon as restrictions lifted, people stayed at home, not fearing COVID, but fearing stepping out of their doors and putting out the bins and being name called, having eggs smashed, thrown at the windows. So I have older people that's not been out of their house for a year and a half. We have had a mountain list of individuals asking for shopping and essentials and prescriptions being dropped off. So for now, the battle is, how do we support Chinese community older people in living a normal life again when they're too scared to step out of their front door because of COVID and hate crime in particular. There's so much more that we need to do in terms of the community centre and the community working with the authorities in terms of what can we do to give people their lives back, their freedom back. And if we want to talk about loneliness, during the COVID period, I had a call from social services. They were looking for, at the community centre, they were looking for an interpreter that spoke a specific dialect that they struggled to find from Language Line. So it was myself that spoke that dialect, so I offered to help. It was a lady that was in a care home that wasn't responding to social services, wasn't responding to her caregivers, and they were trying to give her an assessment, and so decided they were going to find someone who spoke that dialect. So the first few minutes, so I was already told that the lady wouldn't respond, and at some point she's going to stand up and walk away. So the first few minutes of the interpretation, I quickly realized that actually it wasn't because she wasn't responding, it was because she was hard of hearing. She had a hearing issue. I quickly asked the social services how long, and the care home, how long has this lady been in the care home? She's been there for 6 months. So for 6 months, she had a hearing issue, but no one had picked that up. And then she did stand up. And it turns out that she stood up because she had a back problem as well. So she can't stand for too long. So every time she stands up, the caregivers thought she was going to stand up and walk away. In fact, she was just standing up just to relieve pain. She said, so that to me, in terms of what support we have within the system, I know we have the Language Line. In the mainstream services, we have certain systems in place in terms of equality, ensuring that everyone has support. But we as a city, as a country, need to look at all the subtleties and all the differences in all the communities. We all have a right to being given a full everything we need in order to live and receive proper care. I think language in itself could mean so many things. Language could just mean words. When someone is living in isolation, living alone, those words could mean a lot if it's given to them in the right context. If it's given to them in a more understanding and compassionate way. So I think what I'm trying to convey is that the system, the authorities need to work so closely with communities. Communities have all the skills. They understand each of their own cultures and the cultural differences, and these need to be respected, and these need to be written into the care plan, whatever care plan that is.
Thank you, Sarah.
I've gone over.
No, you're all right. I won't tell you off. Don't worry. Don't worry. I couldn't possibly stop you there. That was an incredibly powerful story, especially about that lady in the hearing and her back. I mean, wow, that sums it up beautifully. I always like to say when you speak, Sarah, lots of things, but I'll try and keep it brief, that most of us that are attending this are being paid to be here. I'm being paid to sit here and talk nonsense like I usually do. Sarah is not. Sarah, you do what you do as a volunteer. And I think that needs to be pointed out at times. What would that lady have done if you hadn't have been there? She'd have carried on suffering for a lot longer, really. And that is the power of volunteering. And I go on about that as well, but it just shows that small intervention, but that very, very niche and very specific intervention from Sarah, from you, for that lady has made the world, clearly the world of difference to us. So well done you. Thank you. Thank you for that. moving on, guys, moving on to the lovely, lovely Naureen Khan from St. Luke's to talk about bereavement, isn't it, Naureen?
Yes.
Yeah, over to you. Thank you.
Thank you, Pam. Thank you so much. First of all, thank you so much, Rehneesa, for organising this with your team. I think you've done an amazing job here. And it's so good to see so many different people attending this today. And Sarah, I think it's wonderful what you do. See, I'm very passionate about communities. I love communities. I love cultures. I am right out there. I've been to the Chinese Community Centre, lovely there. This is before the lockdown. I had put a little presentation together, and it is about bereavement and isolation. I'll give you a bit of background for myself before I go into details. And bear in mind that when I'm speaking from end-of-life care perspective, palliative care. But within that, obviously, with the lockdown, we had to wear lots of different hats. So I'm the Engagement and Quality Officer at St. Luke's. My primary focus has involved engaging and supporting diverse communities around palliative care and extending St. Luke's work around equality and diversity. I have about 20 years of experience working in the community, and I'm very passionate about supporting others, particularly the ethnic minorities. I'm very well connected with charities and resource centres in Sheffield and nationally, which gives me a lot of opportunities to support the BAME community. So first of all, we need to ask ourselves, all of us, because when we talk about loneliness, what is loneliness? Loneliness comes in all shapes and forms. I remember, Pam, when you said that, you know, your child is gone into university and you've got a young one at home, you know, and you are a person who's out in the community, but you still experience loneliness. You will, all of us do. So feeling of loneliness is very personal. So everyone's experience of loneliness will be different. And it's right, we talked about big families and that the dynamics have changed with families, and they have changed with all families, not just with Asian communities. I think overall, globally, family dynamics have changed. I think our generation has got a big part to play in it. We have opened doors for our children and our generations that our parents were probably reluctant to do. Our children are moving out earlier. And they're studying elsewhere, and in loneliness could be in every illness, for terminal illness. Like I had clients whose partner had dementia. The wife was feeling very lonely because her husband did not remember her anymore. I can just talk about bereavement, but if you would like me to carry on with loneliness and bereavement together, then I don't mind, Pam, it's up to you.
Yeah, carry on. Yeah, I'm sure anything you say would be fascinating to me, Naureen, but yeah.
Yeah. So the challenges that we need to recognize is, first of all, is denial, blaming. These are the things that in every culture, regardless which religion you are, no religion or a religion, these are the things that are normal. In being in denial, blaming family members. And it's not something that, you know, often I hear is that's not something that can happen to me. You know, I have lots of people around me. And this is often as well, the older generation doesn't recognize stress or bereavement or isolation or being lonely, because I can tell you from my mom, when I say to her, Mom, you got stress, she'll be saying, what's that? We don't recognize stress. And when I point it out to her, she'll be like, oh yeah, that is stress. So that generation was always very close to each other. And I think it's more about education, unfolding things, what it actually is, and to tell them that it's absolutely normal to feel that way and there is help available. And then finding the help that suits them. And you know, confidentiality is very important, and reassurance with anybody, and especially with smaller communities. I think because communities know each other, and this is something that I over and over have to reassure people that it's very confidential. Really important is the relationship building, that as a practitioner, it's important to have a good rapport with service users, and trust is very important. Be non-judgmental, because not every person is religious. Not every Muslim will be a religious or practicing Muslim. So this is something with all the other religions and cultures, that a person might be very cultural. And this is something for you as a practitioner to find out while you're having that relationship of the service with this person. Try to understand the individual's need rather than stereotyping them or thinking that you understand this person because of somebody who's from the same culture. You should listen rather than teach. This is why I always do. I like to listen to elderly, see what their needs are or what bothers them, and the small change that you can make. So try to understand the state of distress or discomfort. So over the pandemic, working for St. Luke's, I had to wear lots of different hats, which was keeping that engagement with the community, keeping that momentum going, that people don't lose track of the services that we were providing. At the same time, I was supporting the chaplaincy team. I was supporting the bereavement team. Now, bereavement is something that varies in every culture, on every religion. It's a personal thing, how people deal with it. So in the pandemic, what I had realized when I was supporting families is that they needed the help there and then, not maybe later, or we can come back to them with, especially if it's a practicing family, they could need the support there and then. So with St. Luke's, what we've done over the years is we've built relationships in the community with the places of worship. We have built relationship with resource centers. We have built relationship with the local faith leaders, the funeral directors. One of the main charities based in London, which is in very support of the ethnic minorities, is 13 Rivers Trust, and we work quite closely with them. 13 Rivers Trust is a charity that is BAME led and is for the BAME community. And what they do is they support people with the bereavement services, people with the funeral cost, if people can't afford it. In the lockdown, obviously, they supported families with isolation, giving them regular phone calls. How we did with St. Luke's is we had close contact with them, because over the lockdown, as you know, people were not just only isolated, they didn't even get a chance to bereave, because we could not meet our loved ones who had passed away. We could not go to the funerals. We could not go to mosques, churches, or any places of worship. So it was very hard. So that's something that is still going to happen, that people are going to be bereaved from this period, because they've lost the loved ones that they did not even know. I was just saying to my friends that people have passed away that we know of, only come to know now that they've actually passed away, because over the lockdown there was only limited contact because we were so busy. I personally have worked all through the lockdown, so not much time for socializing. Like if I'd done Zoom sessions all through the week, I don't think I had time to do Zoom sessions with my family as well, because that would have been too much. With bereavement services, we have our bereavement service at St. Luke's that we support families, but with that we have the chaplaincy team as well that supports diverse families. It's a bespoke service that we deliver. So my part is then when we have families, especially from the Muslim community, I come then in that part. That's my hat then that I wear. I support them with the funeral, I support them with the chaplaincy, and I support them with the bereavement services. What we do as well is, before the lockdown, what we had is in Clifford House, what we did is we did activities. Clifford House was a part of St. Luke's Hospice. At the moment, it's closed because of the lockdown. Hopefully, we're thinking of reopening that as well, but there's many factors that we need to think about, and we will have many services in there. Before lockdown, what we did is we had put some activities in place with volunteers with additional languages, and we welcomed people all over Sheffield who were diagnosed with a terminal illness, and what we would do is we would provide them transport, make them feel independent, and they then could come to Clifford House, and where we had all sorts of activities, could be from yoga, Pilates, IT, or any services that they needed, or support, or advice that was available for them. In that, what I had created was an activity called the Gupshup Club. The Gupshup Club means chitter chatter. Gupshup could be very formal, Gupshup could be very in-depth, and this was starting with the South Asian community, because that's at the moment the largest community in Sheffield. And this is like 4 years ago that we started with the South Asian community. We have like now narrowed down or moved on.
1 minute, Naureen. Sorry to be pushing you.
Yeah, that's fine. So we have moved on to other communities like the Gypsy and the Travels and the Roma community. And I think we should not forget those tiny communities that exist in Sheffield as well. And I think what we've done as well is we have done some great work on reaching out to communities. The work has been published in Hospice UK. Oh, there's a lot more that I can tell and talk about. But yes, definitely, if you need any support with your work, if you need any information, any signposting, do contact me. I'll be more than happy to help you and support you.
Brilliant. Thank you, Naureen. When the chat reopens, it'd be really great if anybody else wants to as well, to put your contact details in the chat.
Sure.
Sometimes at these events you think, oh, she was brilliant, or that was really interesting. How on earth can't you remember her name, kind of thing. So yeah, if you do that, that'd be fantastic, Naureen. Brilliant. Thank you.
Great.
Right, guys, we're going straight over into our next breakout room now. It's just a general discussion about what we've learned today, pretty much. What you think you might implement, what we learned, what specific things, just a short little chat. Hopefully the technology will work smoothly this time, fingers crossed. So we're going to go into a breakout room, and as before, just a slight discussion afterwards, a bit of feedback, and see where we're at. Right, so breakout rooms you can join now. And that was about how we're feeling, what we think, what we sort of learned, wasn't it? The general question, what we learned, what do we think we might actually take away and implement, if anything, what we learned from each other. Does anybody want to say anything? Does anybody want to kick off?
Shall I start? Just
please,
in case I forget what.
Go on, you're like me, Sarah.
Said.
Go on,
right. So I had Susie, Claire, Grace, and Sarah in the group. So we basically said what we've learned, that we owe the system and us and everyone else overcomplicate matters when the issue sometimes could just be an older person had forgot to put the hearing aid in by their caregiver, and rather than checking that, they then get misdiagnosed with mental health issues and other more serious conditions, and then a bit further down the line they realize actually it was just because they've forgotten to put the hearing aid in. So a lot of issues can just be something simple if it was looked at an uncomplicated way. The other one is working with people from an early stage and at every stage. This is working with older people in terms of what they need, and how to look after these needs, rather than deciding this is the system, rather than the system deciding what this person needs, is working with them from the beginning. Yeah. And what to implement, IT was a big thing that we thought in terms of the BAME communities. IT support, there's an issue about costs, not everyone can afford it. How you then put in more education and support in terms of IT. There are members that the group have mentioned that might not have spoken or seen their family members abroad, whereas FaceTime would instantly do that, but then there's a lot of support and costings involved that needs to be looked at. Diversity, inclusion and equality, these three things are not, the group have said, are not even talked about until university level, in terms of whether it's a course on nursing or whether it's a course on working with the community. The group decided that this needs to be looked at and talked about from a very early stage, from school even, from nursery even, and not at university level. Quite often we talk about race and diversity, inclusion, equality. That's at a very late stage. By then, nothing's been implemented, and then it's time to come out of university and it's time to work. So they're the insights from the group.
Fantastic, incredible. Well, look how far we're stretching here. We're going to go and change the world, I think, aren't we, with our little webinar here? Fantastic, really, really great. Thank you for feeding that back. The lovely Graham from Sheffield FC has his hand up, I see. He knows how to use the technology. So if you want to unmute yourself, Graham.
Yeah, thanks, Pam. I really want to share what I've picked up over the last hour and a half, really, because it's really powerful stuff, and I think some of the work that people are doing is just, well, it's just phenomenal. So well done, everybody. It's really inspirational stuff just to be in the room. But there's some things I've picked up just from a fresh perspective, and just to give people a little insight. Sheffield FC, our community department's really, really new and in its fledgling months, really a couple of months old now, and we feel we've got a bit of an accountability to our community, of course, being a sporting venue, with everything that's so linked to sport and football in particular, but certainly not using football as a barrier. But we want to reach out and we want to make a difference, like everyone in this room does. Some of the things I've picked up personally here is certainly listen to people, and the education piece is crucial, isn't it? We all know that moving forward isn't always about the absolute end goal to start with, because that can be a little bit frightening. So I just wondered about some personal goal setting pieces, whether we can do that within our local communities, where actually we become more accountable for our own families first, and we start, reaching out to our own family members that are aging and lonely and exposed to the fact that they're on their own and all the barriers that they face daily. So firstly, getting people into that type of habit, and then actually extending that to our neighbour and then to our community. So almost a little bit of a process of the education, where actually we start to encourage people to do the simple things first, and very similar to what Sarah mentioned there, not everything has to be so complicated. Actually, simplify the process and take it as a stepping stone situation. Now, the education in the main, we'll all understand about the exposure that we all need, because without it, we become incredibly, I don't know what the word is really, but we just don't have the understanding that we really would like. And I think just exposing ourselves and exposing people, exposing our children to wider communities is just going to help. Now,
no, we're losing you, Graham. You're going.
So, probably the most of all things. Yeah. So I've heard language has been brought up the most of all the barriers, despite there being hundreds, if not thousands, of barriers. But communication being the great resolver of many problems. I just wonder if there's a real need for a drive for some Makaton training, even at basic communication level. Now, I deal with that on a daily basis, working in disability very often. And it is such a valuable tool that even my 3-year-old daughter knows very, very simple, basic introductory communication pieces. That I just wonder if we could do something around our communities about Makaton, so it does bring a universal language together. Wow. And something that's visual. Mm-hmm. And actually, even our carers, our workers around that have that basic understanding, so that somebody saying, I just have a bad back, is possible and more possible, or I need to stand up because I'm not leaving, I'm in pain, as we've heard before, or I just don't know what to do. And that basic communication level in a Makaton form would be powerful beyond belief, I think. So I think that's something that I would certainly want to implement, some Makaton training. And as a football club, I think, despite us being a football club, as a hub for the community, that's something I'm desperately driving towards, introducing our community of all levels, all ages, because we'll need that. But certainly, if we could get some training involved for our carers, wonderful, so they can start even the basic of good morning, how are you, that will open
I think you could be running your own webinar with that, Graham, personally. I think we'd all sign up, certainly.
Yeah, well, maybe
You sold it to us.
Fab. So I think that's something really important. And
Brilliant.
And ultimately, as a sports club, I've got an idea that I've had for a very, very long time. And I wonder if just bringing people together through almost a junior World Cup, where we could all represent our country and have a cultural village with food and music going on at the side of that, while there was a little junior five-a-side, boys and girls playing. And actually, I think that's an idea I've had for about 10 or 15 years and never put into place. So I think that's something that I'd certainly be moving forward with. But thank you to everybody for your input, because it's been really powerful stuff.
Brilliant. I love that idea. Sheffield would be the place to do that, wouldn't it? So fingers crossed, watch this space. Thank you, Graham. Elaine from the Terminus Initiative, you've got your hand up.
Hi. Yeah, it was just to kind of say that I went into this breakout group with a couple of questions, and the questions were, how do, when Sarah was talking earlier, how do, in order to kind of try and help with that, how do we encourage people from those communities, younger people, to come forward to work in this sector? And, how do we identify who these people are? And actually, I've sort of come back with where the Terminus is concerned. And I mean, you, Pam, know the community and the demographic there more than any of us. And I was kind of saying that, 10, 15 years ago, that community was very much 90% white, British working class. But now, in the last 10 years, it's really kind of vibrant with lots and lots of communities. And I think we really need to work harder to be more proactive in working with the younger members of that community, so that we can grow a trust, so that actually this may be going forward, I would pray, would not be so much of an issue, because we've already got that working community with us. But I do think that we don't have enough in place, and I think we need to, that is something that I'm taking away from this today.
Fantastic. Thank you, Elaine. Thank you for that insight. Yes. Is there any more feedback? I think unless anybody's desperate, I think we've got to move on. We're desperately running out of time. So this is such an important subject. Moving on to any questions, basically. So there was a panel, there was some number of people that have spoken today, and this is an opportunity to put any questions to the panel. I think Rehneesa is suggesting, or was suggesting also, if people want to stay in touch with people, you could, if you want to share your contact details, please feel free to in the chat. Really, that's a great opportunity for people to share contact details. Over to any questions. Does anybody have any questions? We've got about 10 minutes, not even probably, to answer any questions if anybody, or try and answer any questions if anybody's got any. So Lubna, I can see your hand up.
Hi everyone. So I've got two questions, I think. One for Graham, who was just speaking. Sorry for my ignorance, but what was the word or the language he was referring to? Makaton. So I'd like
Makaton, wasn't it, Graham? Makaton. I've seen Graham teach Makaton, so that's okay. Fantastic.
So when we're sharing the links, maybe something like that could be shared, because I'd really like to know more about that. And then I think somebody here, Cheryl Bowen, has talked about a museum. So I'd like to know more about the museum and what we can learn from there, or what the museum is about, and how that can be useful for, curbing isolation and loneliness.
So maybe Cheryl and Graham, you could add your email addresses in the chat if you like, and then anybody who's interested in that, and I'm sure it's not just Lubna.
Yeah, Cheryl's email is on there, and I'll just...
Fantastic.
Nice to know.
Yeah.
A link would be useful as well, so we could look the museum up. Thank you.
Brilliant. Any more questions? I can't see if anybody's got any hands up, so you might have to maybe shout up, unmute yourself and shout up, if that doesn't come too chaotic and too much of a free-for-all. Was that, I think there was a question, unless there's somebody in the chat earlier, somebody put a question about funding. I don't know if there was a very specific question, but I can talk a tiny bit about that. In my role, I'm engagement and equality lead for Voluntary Action Sheffield, and part of my role is to help BAME organisations link in with getting support from VAS or wherever, and also linking with funders as well. To a degree, I sort of sit on funders meetings, and funders ask me my opinion and ask me opinions of others of how they can reach out to sort of BAME organisations, really. So I'd say if anybody wants any support, you can get some extra support through Voluntary Action Sheffield, but also SciFab. I can't remember what they stand for, but that's an organisation in Sheffield that specifically does that, really, as well. And I do, you know, on behalf of the funders, I can certainly say from what I've heard them say, they're desperately trying to make things easier, to encourage smaller organisations, BAME organisations. For example, I was part of some micro funding that Age Better has put out, and they're going to put out some more money. And their criteria was just talk on a WhatsApp video for 5 minutes and send it to us. Simple as that, you know, and that was between £200 and £2,000 they were giving away. And there were some fantastic ideas, and people have got that money, and there'll be more money coming with that, really. So yeah, little things like that you all need to sort of, oh, thank you. Somebody's put the link in for SciFab, really. So yeah, that was just one part. Is there any specific questions about all the wonderful things we've heard today? Anybody? If not, go on.
Yeah, sorry, as I said, I'm still quite new to this, but I have come across 2 people who have got bereavement issues, and that's a totally new thing for me. So how would I get in touch with Naureen, for example, bereavement and loneliness? And one is actually the pet bereavement, and another one is a hospice, but it's stopping them from moving on. So it's almost like a counseling thing. So I said, it's totally new to it, and I'll just, after any advice already, help them. So yeah, so how would I get in touch with Naureen? It's
Naureen?
St. Luke's bereavement service.
Do you want to unmute yourself, Naureen? Or again, I'd say to Naureen, like I said, if you can, Naureen.
Yeah, that would be handy, wouldn't it?
Yeah,
I mute myself. Is it Zaid? Yes. Are you? Sorry, I kind of, you broke up a little bit. It's about bereavement services you asked, right?
Yeah, basically 2 people supporting both different types of bereavement. One is a pet bereavement, and another one is a husband. They both have the almost same level of ability to shift, to move on, and I just wanted advice and steps that I could use. Well,
So in Sheffield, we don't really have bereavement services for ethnic minorities. We have the mainstream bereavement services that we have. What we do through St. Luke's is we try to reach out to different communities who are patients with us or who are clients with us, and we try to support their families. That's from our perspective. But if you get in touch with 13 Rivers Trust, I will leave their email in the chat box as well. And what 13 Rivers Trust does is they support ethnic minorities. They are based in London, but what they do is they try to support nationally. On the weekend, I help them, I support them with the workload. And what we do is we try to give one-to-one to people and try to understand what kind of needs they are. And I think if I leave you with their email address, then do get in touch with them and explain them, because I think once you can give some background, then they could put something in place for you and then support that. What 13 Rivers Trust is trying to do is support similar work in the north, based in Sheffield, that's yet to come, and it's all to deal with these kind of services that are actually non-existent. And they should be, because we are a very big group of diverse communities in Sheffield and other cities as well. So over the years, why it's not been picked up, they're having a seminar on that as well, the inequalities in what have been happening over the years, and especially in the lockdown and the pandemic. Why didn't the Chinese community get the help? Why didn't the people with dementia get the help? So these inequalities are there and they need to be questioned about that. And I think they are having a seminar on the 13th of November. I can give you details for that as well. So if you, the people from NHS, people from local communities, local authorities, health professionals will be all involved. And I think it'll be great for us to learn as well how we can support communities in Sheffield. But as I said, I will leave you definitely some information in the chat box and get in touch with them, definitely.
Thank you.
Thank you, Naureen. So please, yeah, please, Naureen, share your contact details. I think there's a few people. I think we'll be making lots of work for you, but anybody else, I don't think we're allowed to share a huge list or anything like that, but anybody that wants to put their contact details in the chat, please do so now. We're down to our last 5 minutes, so I don't want you to miss out on making the contact with anybody. Is there another question before we wrap up? We're desperately running out of time here. Anybody desperately got a question?
It's less of a question.
Go on, Ray. I recognise the voice.
When Rehneesa was mentioning earlier about the potentially doing this again, I think it's been absolutely brilliant. I think the speakers have been brilliant. And in our breakout group, it was mentioned about the case studies and hearing the case studies, knowing the subtleties and change has been really, really helpful. So in response to when Rehneesa said, you know, would there be appetite for this kind of thing again? I think absolutely. You can't hear enough, I don't think, in situations like this. So yeah, just that, less of a question, more of a that'd be amazing.
Thank you, Rael, and thanks so much for joining us. It's great to have you on here. Definitely, I have sent a survey link in the chat and we'll send it via email. On there, there'll be questions. Do you want to hear more from us? On what kind of topics do you want us to cover? I'd really encourage everyone to complete it because it's our first event that we've done. So if you would like more from us, it would be really great to hear your feedback so we can cater it towards what you'd like and also improve on how we deliver it. Maybe you want more discussion time, maybe you want more like speakers talking. So yeah, I'll encourage everyone to complete that, and definitely it's something we can look into.
Thank you. Great, thank you, Ray, for that feedback. Bless you. That's really, really, really important. I think time has come where we've got to, wrap up. Really, the time. We've got 3 minutes left. Just to say, it's clearly been a fantastic event. That's evident on the amount of people that have come and joined in, the discussions that we've had, the insight we've had, our fantastic speakers. And I think it's pretty much guaranteed that there will be a follow-up event because I don't think it takes a rocket scientist to work that one out, which is fantastic. Just a couple of thank yous and reminder that Rehneesa's feedback she was saying about this survey is not only is it interesting and good to get that survey, it's also really good because that will help for funding for anything that anybody ever does, isn't it? I go on about the dull, boring feedback stuff, but the importance of that means that hopefully that will lead to funding and more stuff can be done. Simple as that, really. I'd just like to personally thank Rehneesa and her team for asking me to chair this. It's been an honour and a privilege, and it's been really, really fantastic thing to be part of. I also want to point out that thank the ladies behind the scenes, Erica and Helen and Rehneesa, for putting this all together. But importantly, I want to thank Tim, the chair of the S&4Cs, for putting this together, and also your trustees that you mentioned, Tim. I'm sure none of this would happen unless this had the backing right from the top of any organisation, putting this at the forefront of of your day-to-day work and giving this priority. So credit where credit is due. Is there anything anyone else wants to say before we finish 2 minutes before the end of time?
I also just want to quickly thank you as well, Pam, for it's been amazing having you to chair this event, and thanks so much to everybody for attending, and also Naureen, Sarah, Helen and Erica, and Shahida as well. We chatted leave a little bit early. We wouldn't have been able to do this without you, so massive thank you, and also to Tim. It's been great to hear from you as well.
Fantastic. Thank you, Rehneesa, for all your hard work, and we'll see you all again very soon. Thank you very much.